Good morning, everybody. I'm Dan Suffoletto from Public Health Dayton and Montgomery County. We have another Facebook update for you here today. We have a very special topic dealing with outreach to the minority community, specifically African Americans. And we're going to have some great speakers here for us. We have Dr. Alonzo Patterson with us. We have Fabrice Jewin. He's with our local Office of Minority Health here at Public Health Dayton and Montgomery County. We have Mayor Nan Whaley, who's been helping us out with leadership around this issue. And then we have Reverend Renard Allen from St. Luke Missionary Baptist Church. And then we also have Reverend Margaret Holt Salmons from Christ Church. So we thank everyone for joining us here today. And I just want to give everybody a quick update before we get into our actual panel. Right now, it began at 8:30. We have registration on our website and by calling our hotline number at 225-6217 for those individuals who are 70 years and older. So next week, we're going to have another vaccination clinic here at Public Health Dayton and Montgomery County for that age group. And you're welcome to visit our website now while you keep listening. Visit our website now and or call to make an appointment if you fall into that particular group. All of the information about vaccinations is available on our website at phdmc.org. And it's important to remember that public health is not the only provider that is providing vaccinations here in Montgomery County. You can go to any number of places, and all those places are listed on our website. And it's important to remember that right now we have a limited supply of vaccine, so it is taking a little bit of a time for the state of Ohio to go through all the priority groups, but they're trying to get as much vaccine as possible. The actual supply and flow of the vaccine comes from the federal government. So the state of Ohio learns each week how much vaccine the state will get. And then from there, they determine how much vaccine can go to each provider in each county and locality. So Public Health Dayton and Montgomery County does not directly control how much vaccine we receive. We get notification weekly from the Ohio Department of Health, and then we schedule accordingly based upon that amount. Also, each provider, such as pharmacies, healthcare centers, they also don't know that far in advance. They get notice weekly, and then they can make their determinations about what they can do for that week. So all of that information is available on our website. So you want to keep that bookmarked, check back regularly. As we get new information, we will provide it there for you. So at this point, I think we want to start out. We're going to talk with Dr. Alonzo Patterson. He's going to provide some comments about safety and efficacy of the vaccine. And Doctor, you're with the Pri-Med Physicians. And if you just want to talk a little bit about the background of the vaccine and how safe it is.
Thank you. I appreciate the opportunity to take part of this, and I'll do my best to give people the information that they can really use to make good decisions. When you look at this particular vaccine, the vaccine is new in that it's using technology that we haven't used before, but one of the concerns that I have a lot of people have about the vaccine is the quickness in which the vaccine was developed, because, you know, we just started seeing this a year ago and now we have a vaccine already. We know that the work on this type of vaccine has been ongoing for 25 years. And in the last 10 to 15 years, the focus has really been on the technology that's specifically in this vaccine to use messenger RNA. That technology was developed in part because of previous encounters with similar viruses that we've had. There's been 2 other regional outbreaks that didn't quite reach a worldwide pandemic of similar viruses, with the SARS epidemic that happened in 2003 and the MERS epidemic that happened in the Middle East back in 2012. So we've used this technology before. In 2017, there was actually a paper published that talked about the effectiveness of using messenger RNA vaccines for coronavirus, because those 2 previous epidemics that were regional in nature also were caused by coronaviruses. So this really isn't new. With the way that we have information exchange now on genetic materials and stuff like that, researchers were pretty much able to get started with trials right around the time that the virus was really hitting the United States. Dr. Kizzmekia Corbett and her team at Moderna was really working on this vaccine starting on January 10th of last year. The first patient wasn't diagnosed in the United States till January 19th. So people had a good head start on the information, and they had a good start on knowing that there's a way to use this information to develop an effective vaccine. And we did move fast through some trials during this vaccine, but moving fast through some of the trials didn't compromise the number of people that were enrolled and the fact that we looked thoroughly at a wide population. Usually phase 3 trials of vaccines have somewhere between 3,000 people, 5,000 people, 6,000 people. There's been a couple that's had a lot more. And for the phase 3 trials with both of these vaccines that's available now, we have more than 30,000 people involved. And even though there had to be a push to diversify that, what we ended up with in the United States was a trial that had 10% Black participants, 20% Latinx participants, 6% Asian participants. And when you look at the population of the United States, about 13% of the population are Black, about 20%, 19% are Latinx, and about 6% are Asian. So we weren't far off from any of those populations, hitting some of them right on the head in the diversity of the people involved. So we know that the safety and efficacy data that was taken from these vaccines represents safety and efficacy of people in the United States. Another big concern I often hear about, because they hear the words RNA and know that that has something to do with genetic material, is that this is somehow changing your genes, but it isn't. I heard a good example of a way to look at this last night from a colleague, Kimberly Manning in Atlanta. And she said, our body's DNA is like the blueprint of what happens in our bodies. The RNA is like the foreman that builds that building, builds that house, the construction foreman. So by using that RNA, we can have our body build something that our body can then respond to. And she called the spike proteins that our body develops as a result of the vaccine, the gangster protein. It's something that's trying to get into that building that shouldn't be there. And our body gets the security on board. So it gets our T cells and our B cells to develop antibodies that can fight it off, so that if they ever see it again, they know that that's not supposed to be there. But after that, the RNA is destroyed and leaves our body. So it doesn't change anything about our genetic makeup. It uses what's already there to help our body develop a ability to fight it off. And inoculation isn't anything new, and it's not anything new for people of African descent. The first documented inoculation that was used to combat disease here in the United States really happened in 1706. When an African slave talked to someone about how they prevented smallpox in Africa. There was documentation of similar practices being used in China and other Asian countries and Middle Eastern countries at the same time. So this is nothing new. But just like back in 1721, when the smallpox ravaged the United States and misinformation prevented people from doing inoculation, we have that same thing going today. Most side effects that people have are mild, lasting 1 to 3 days, usually soreness and pain. You hear a lot about Bell's palsy, but we found that the amount of people who've had Bell's palsy was actually fewer than the number that happens in the general population without there being a vaccine. And the same has been true when you hear about deaths that have happened. Unfortunately, the fact is that people die every day in the United States, and a whole lot of them do. That doesn't always mean that it was because of a vaccine. More people are dying because they're not immunized than have been. There was one study recently done in a nursing home that found of the 7,000 residents in 118 facilities throughout the country. This is the company that has the largest number of nursing homes in the country. Of the 7,000 people that were immunized, they found that death was happening more often in people who weren't vaccinated than were vaccinated. So the thought that a lot of the deaths that get kind of talked about in the news are related to vaccines is one that isn't bearing to be true. It would have been expected in the time that we've been given the vaccine in the United States that there would be 168 deaths that are sudden and unexplained in people in the United States under the age of 65, but there's only been 18 reported to the Vaccine Adverse Experience Registry. I think that time is going to tell the true story, but we have to look back to the experiences that Onanismus gave us in 1706, the work that Kizzmekia Corbett has done on this vaccine, to know that we can use the information that we have in a way that helps people and helps to restore some semblance of normalcy to us. You know, we have to get through this, and we need everyone's participation to do that. It's not going to happen if just certain segments of the population are taking advantage. And I don't want misinformation to be the thing that we act upon. So I'm here to certainly answer any questions that folks may have to the best of my ability, and hope that you continue to participate in venues like this and others that will be happening to get the information you need to make a good choice.
Okay, thank you, Dr. Patterson. Some great information there, and that's what we're here to do, is to provide information, and we have some more coming up for you here. And we want to make sure you understand that the minority population, and in this case specifically African Americans, are very important to us here in Montgomery County. We want to make sure that nobody gets left behind. And on that note, we have a specific department that works on that. We have our local Office of Minority Health, who is looking out particularly for minorities in Montgomery County, and African Americans in this case, who happen to make up the largest minority in Montgomery County. And we have Fabrice Jewin with us here today, and he's going to talk a little bit about how his office is helping to facilitate what's happening here in Montgomery County around our minority population. Fabrice?
Thank you, Dan, and good morning to all community members who are tuning in. As Dan mentioned, my name is Fabrice Jewin, and I am the project manager for the local Office on Minority Health at Public Health Data in Montgomery County, and I really appreciate this opportunity to address you all today on this important matter. Over the course of the COVID-19 crisis, public health, like the rest of the nation, has observed that our county's demographic minority groups are infected, hospitalized, and die at higher and disproportionate rates from COVID-19. The Ohio Department of Health's COVID-19 dashboard on case demographics shows that our American Indian and Alaska Native County residents make up about 1% of local COVID-19 deaths, despite only comprising 0.4% of our county population. The dashboard also shows that our Black and African American county residents make up about 24% of the local COVID-19 deaths, despite only comprising 22% of our county population. Our Hispanic population is also experiencing high rates of infection, hospitalization, and death as well. Even if we discount the significant amount of our data that is incomplete or listed as other and unknown, so missing data that could potentially be hiding the true gravity of the issue, no other demographic groups contribute more than their population proportion in COVID-19 case demographic data categories. Public health also recognized very early on that the socioeconomic disadvantages experienced by these vulnerable community members prevent them from signing up for vaccinations due to things like lack of reliable internet or phone line, and also prevent them from accessing vaccination events due to things like a lack of transportation, restrictive work, and home obligations. While numerous weekly vaccination opportunities will continue to be open to the public at the Dayton Convention Center and other potential future locations, public health has taken the necessary step in addressing this observed health inequity in the county by collaborating with different community groups and organizations that service these vulnerable demographic minorities to help address this issue. Our first realization of this step is displayed by our partnership with St. Margaret's Episcopal Church to host vaccination events that are more accessible to our Black and African American residents, one of which is happening as we speak, and another successful event that occurred last Saturday, January 23rd as well. As a state, Ohio is gravely behind on the vaccination of our Black communities, as displayed again by the Department of Health dashboard. Black and African Americans are the only racial group to not have eclipsed a 3% proportion in total demographic group vaccination. We are behind in protecting our Black and African American neighbors, and these vaccination events that we are hosting as public health represent our efforts to buck this trend. On December 4th, 2019, Public Health and the Board of Health passed a resolution to adopt a health equity and all policies approach to improve population health in Montgomery County. Then on July 1st of 2020, Public Health and the Board of Health passed another resolution to declare racism and discrimination a public health crisis. Our emphasis on fostering equity in our vaccination planning and efforts is a direct follow through on these resolutions. and shows our dedication to making sure that these intended goals that we have presented and promised to our county community and its residents don't just live on paper, but are represented in our actions and in our vision to see Montgomery County as a healthy, safe, and thriving community for everyone living in it. While our Black and African American residents represent the largest minority group in the county and demanded our immediate attention based on the well-documented local, statewide, and national health disparities observed during and even before the COVID-19 crisis, moving forward, we have every intention of widening the scope of our messaging and accessibility efforts to ensure that other minoritized demographics are included in this cause towards establishing true vaccination equity.
Okay, thank you very much, Fabrice. Some great information there as well. And to follow up a little bit on what Fabrice said is when public health is determining what programs we're going to do and how we provide services and information to the community, we don't do that in a vacuum. We work with the community and we listen to the community and we have them help us on our initiatives such as infant mortality and other issues. And one of the leaders in the community who's been helping us connect with the community and providing leadership is Mayor Nan Whaley. We want to thank her for joining us here today. And Mayor, can you tell us a little bit about your involvement with this group and how you're helping facilitate what's happening here in our community?
Look, it's great to be on and want to appreciate Dr. Patterson's great work and Fabrice's great work and certainly public health in this work. The clergy members you're about to hear from have really been doing amazing, not only sharing information from public health over the past year, but then also giving feedback to public health and our community on how we can, quite frankly, do better. And certainly we're pleased public health declared racism a public health emergency. I think their actions and public health's actions this past couple of weeks from the vaccination, what people across the state are calling the Dayton Plan, makes me very impressed that they're walking the talk. So just to give an example is when the 1B started to be dispersed in Montgomery County, public health intentionally took a quarter of those vaccinations that they were allotted from the state of Ohio and placed them at St. Margaret's Church. They discussed with the clergy committee, a group that we meet every Friday morning at 8:30, where that location could be. The clergy decided that location. Public health placed those vaccinations in the community in a place that folks trust to make sure that they had access. No other community in the state really did this, being intentional on the front end around equity. And it's something that other cities across the state are now trying to replicate. That's the kind of work that we have to do and consider in all of the work around health. And I'm just really proud of the equity lens that public health is really walking the talk, something that is such a scarce resource. Vaccinations are hard to get, but being intentional about making sure they're in the community, that it's not getting served by health conditions, not being served overall, and also building trust with that community. That's the kind of work that we have to do over and over again. And I'm really proud that public health decided to do it on something that is the most scarce thing that we have right now, which are vaccine supplies, out of no fault of our own. But I'm really pleased with that. The community has responded well. And I think that wouldn't have happened without the clergy being engaged every Friday morning at 8:30. It's become, I think, one of my favorite communities. We get together with public health and the clergy members, all clergy members are invited to come forward, ask any questions about it in any phase of this public health crisis that we've had. And then they're able to share that information with their groups as well. It's been, for me personally, a rewarding experience to be a part of these calls and given me support, frankly, through what has been a pretty terrific, difficult year to lead through. So Dan, if it's okay, I'd like to just introduce Pastor Allen from St. Luke's Missionary Baptist Church. He's been a devout member of this group every week, asking all kinds of questions. I should also mention that Pastor Allen and Pastor Margaret's family have been touched by COVID, some of them personally. And so we've watched too, as we've prayed for members of our clergy community who've had family members be hospitalized, et cetera, through this. So this has all touched us very personally as well in the community that we've created. Pastor Allen, I'm going to turn it over to you. Oh, you're muted, Pastor Allen. Thank you.
Thank you, Madam Mayor, and all who are on this call. I'm privileged to simply share this opportunity with you and lend my voice in support of the information and insight that you are developing. I have one point of emphasis to make to um, the minority community, and that is education and enlightenment is not the enemy of faith. Faith and reason are compatible. And it is very important that we keep in mind um, not only the scientific um, information that we are receiving, but that we balance that with an understanding of our faith, which no matter your faith tradition, involves and requires that we be good stewards of our bodies, that we see our bodies as not simply our own, but as the temple of our Creator, however we interpret and whatever we call the Creator. Most religions teach that the body is an essential part of our devotion to the Creator and an essential part of our purpose in life. And so we should care for it. And failure to take this vaccine has spiritual as well as social and personal implications. Furthermore, I want to encourage all minorities to please expose yourself to as much information as possible. Mayor Whaley has done an exceptional job in providing and supporting and participating in innumerable opportunities to provide education to the masses concerning the vaccine. She is to be commended for that. She is to be trusted for that. I myself am greatly benefited by what Dr. Patterson shared, by what Mr. Fabrice shared. I have learned a lot in this short time from the first pandemic or the first vaccine experimentation in America in 1706 to understanding the impact on minority communities, Fabrice, and how we are somehow still left behind even now in this process. And so this is the kind of this is the kind of engagement, this is the kind of enlightenment that my faith source and teacher Jesus referred to when he said, "Ye shall know the truth, and the truth shall set you free." We must seek the truth. Fake news is not sufficient, and we need to rely on science to provide us that information to which scientists have dedicated their lives studying. And we need not see that information as in any way a threat to our faith. It takes faith to take a vaccine that you have not had before. It takes faith to believe that this is what is best and this is the manner that God has made healing available to the masses. So to deny the vaccine might be actually denying one's faith by refusing to accept the fact that God uses science in order to lead us to avenues of healing. Not all healing is instantaneous. Not all healing is non-scientific. God can, if he's God over every other area of our world and life, then he's God over science. And he can use that as a vehicle for us to be healed and to be whole, both personally and communally. So again, I come back to my main point of emphasis, even as a person of faith, as a leader in the faith community, unashamedly devoted to my faith. I encourage us to not see education and enlightenment as our enemy, but to understand it as a necessary tool that is a gift that makes us uniquely who we are. The imago Dei is the Hebrew term for made in the image of our Creator. And what distinguishes us is our ability from the rest of creation is our ability to reason, to think critically, analytically, and to make decisions intelligently and from an informed perspective. So failure to do this is really a failure of faith. And I hope that we will rethink our faith, but not so much rethink our faith, but that we will rethink our perspective on science, and that we will learn how to embrace the best of it and pray about the rest of it. Thank you.
Thanks, Pastor Allen. Pastor Margaret Sammons has been one of the great members that has kept us organized, advocating for different pieces of legislation. We really appreciate all the time she puts into this work. Pastor Sammons, I'm going to pass it to you. Oh, you're muted too. I get to tell everybody they're muted, Pastor Allen. That's my thing.
Thank you all, and thank you, Pastor Allen, for those encouraging words of faith. When my mother was 16, she had polio. And I still remember her reaction when the first polio vaccination came out. She kept going around the house saying, "It's a miracle, it's a miracle." And she immediately signed up to help with the March of Dimes vaccination clinic at my school because she was determined that all of us and anybody's child was going to be spared what she had gone through. What I didn't know until recently is that in the South, where schools were segregated, the March of Dimes did not go to most Black schools. There was a myth going on that Black children did not get polio. And the result was that to be vaccinated, they had to go to the white school and they had to go in the back door. I am so proud of our mayor and our health department for shattering that mold of inequity, and for their openness to listen to clergy about where and how we can vaccinate people in a way that is comfortable for them and likely to be accepted, and for working through the churches. At Christ Church Dayton, we discovered that, and I am new there, but discovered that there was a lot of confusion the first week among the 80-year-olds. And so very quickly, we put together a new page on our website listing all the sites. And every older person was assigned a partner in the parish from the pastoral care team, because not all of them have access to the internet. And of course, some need help. So they have been walking them through the registration process. My job is to update that site with what I hear on Fridays. And we hope that they will all, who want it, have a chance to be vaccinated. Now I want to say, as I was listening to Fabrice, I think we're all aware that because the west side of Dayton has been hit harder than white communities, it means that there is a preponderance of grief there as well. The grief that families carry when they lose anyone, and I think all of us have been touched by that in some way. We have lost a family member. But on that side of town, the intensity of it, because of the intensity of illness and death, is incredible. To people of faith, I think that our public health department is like my mother. You are determined that the pain on the west side is going to stop, that there will be a time of healing coming very soon. And just on a personal note, I'm a grandmother. And I can't wait to get vaccinated because it's been a long time since I've held my grandsons. And I want them to grow up knowing who I am and knowing how much I care for them. And that's what God wants for us all. You know, as Dr. Patterson said, if only a few of us take the vaccine, it's not going to do much. But if I think the herd immunity is reached 70, 80%, then we can return to the lives that God meant for us. Lives where we can play with those we love, we can take them to movies, we can send them to school, we can have them for sleepovers and cookie baking without fear. So I want to say thank you to our mayor and to all of you in public health, because what you are doing in intentionally reaching into the minority community is the work of God. And I believe you have been inspired and energized to do this by the Holy Spirit.
Thank you, Pastor Margaret, for those beautiful words and just such kindness. And thank you both for your time and your talent and your treasure in this work. We're so grateful. You make, I think, make our community stronger with your voices for sure. Dan, I'll turn it back to you.
All right. Thank you, Mayor.